Thank you for joining the first ever RECOIL Offgrid live stream webinar. I'm going to go over a couple of ground rules, some of the structure about how this is going to work, but first I want to thank everybody for coming. I know that it's tough times everywhere right now. I hope that everyone is healthy and safe and as happy as they can be under the given circumstances. We wanted to do this for a couple of reasons. This is our first time doing a live stream or webinar type format for Offgrid. You know, one of the reasons is that we know that a lot of you people are in isolation or quarantine, social distancing, whatever label you want to put on it, but that we may be disconnected a little bit from our friends, families, our social support networks. So hopefully we guys can give you 30 minutes or an hour of having some connection, both with us as a brand, with the other people that are viewing and that are going to be in the live chat, and with our panelists. And then the other reason we wanted to do this was to do what we always do, which is to give you guys the most timely, most accurate information about what's going on in an unfiltered, unbiased format. So for those of you just tuning in, if you are participating through the Zoom website or the Zoom app, you should see a Q&A bar at the bottom of your screen. And so you can actually type in questions in real time for our panelists. I'm going to have the panelists introduce themselves. We'll do a little opening chit chat. I do have some questions for them that we've preset to get the conversation going. But then after that, we are going to open up the field to you guys. We want to hear what your thoughts, feelings, concerns are. And if we can answer them, then we will. My co-host, Dave Merrill, will be interacting with you guys directly through the Q&A and through the live chat on Zoom, as well as on Facebook Live, where we're going to be parallel streaming this as well. So please feel free after the first couple of minutes, start sending in your questions, thoughts, concerns, comments, and we'll do the best we can with that. So with that said, we're going to get started. We originally had 4 panelists slated. Unfortunately, 2 of them are not with us right now. One is a fire captain and one is a cardio surgeon. Both of them were called away probably within the last 10 minutes, dealing with real life crises as a result of everything that's going on right now. We do still have 2 panelists. We're hoping that the other 2 will join us as they're able later in the conversation. But right now, to do a quick round of introductions, Joey, I'm going to start with you. Please tell us a little bit about yourself.
How are you? I'm Joe Nickersher. I'm currently the chief of the Patterson Fire Department, Putnam County, New York, that is in the Hudson Valley, and I'm just about an hour north of New York City. I am a retired detective for the New York City Police Department, among several other things. I'm a technical rope rescue instructor for the most part. Thank you.
Awesome. Thank you so much. And then Dennis, please, if you would.
Hi, I'm Dennis Santiago. I think I'm the nerd of the bunch today because I'm here for the cybersecurity and internet part of the discussion in terms of what's going on with that. I'm also a high power shooter, so I get into that as well. And I also am a volunteer with the Manhattan Beach Police Department out in California.
Excellent. Thank you so much. And nerd or not, we're happy to have you. There are obviously some very serious cyber-related concerns that people are trying to exploit the pandemic. So we're glad to have you on. And I'm definitely going to have a couple of questions just for you here in a minute or 2.
One quick note for,
yes,
for everyone attending in the audience. When you have direct questions for the participants and for the panelists and for anything, there's a couple ways you can do it. Ideally, you want to go to the bottom of your screen where it says Q&A on there, and then they'll have the questions being asked and answered. And then when it's appropriate, I can interject and then talk to the panelists, because we want them just to worry about having the conversation right now. There's also a chat window here in Zoom, so you can BS with your friends. You can ask questions in there too, not ideal. And we're also on Facebook Live right now on the RECOIL Offgrid page, but there is some lag there. So, but I'm monitoring that as well. So.
Awesome. Thank you. So we got lots of ways for you guys to chime in. Like I said, this is an audience participation exercise. We're happy to connect with you guys. We're happy to hear what you have to say, and hopefully we can get some of your questions and concerns answered. So I now have a question for both Joey and Dennis. Dennis, I'm going to start with you, and then we'll roll over to Joey. But the opening question here which you guys touched on already a little bit, but I want some more detail if we can get it, which is specifically what part of the country are you guys in, and what are the current lockdown or shelter-in-place conditions like for you in your area? Dennis,
Okay.
if you would please start us off.
Sure. I am in the Los Angeles area of Southern California. The area is currently on a lockdown of what they call Safer at Home, which is a statewide lockdown where people are, you can only go out for essentials at this point. So groceries, pharmacies, that type of thing. You can take walks, take your dog, get exercise, that type of thing, but you are supposed to maintain at least a 6-foot distance between you and any other person that you are not related to at all times.
Excellent. Thank you so much. Ironic enough that we have a panelist from Los Angeles and one from New York, unfortunately 2 of the hardest hit parts of the country. Joey, why don't you tell us what it's like on the other end?
Well, New York is on what they're now calling a pause. So very much like our other panelists said, we're not supposed to really be going out. They want you to keep a 6-foot distance if you do go out. There are some stores open, grocery stores, restaurants for takeout only. There is no dining in anywhere. Most businesses are closed other than the vital essentials, grocery stores, supermarkets, the local Rite Aid, CVS, those kind of places, drugstores. Otherwise, pretty much everything else is closed right now. We've been like that for about a week now, and we anticipated a couple more weeks.
Okay. Dennis, how long have you guys been on your Safer at Home protocol?
That protocol has been in place for about a week and a half, and the estimates here, because they're trying to contain the spread of this over the entire state of about 33 or 38 million people, is they think this may go as far as into the end of April, quite a bit.
Okay. So everybody, at least on both coasts, is looking at least a couple more weeks of this from what it sounds like. So, okay, well, with that said, Joey, I've got a question for you. Obviously, for medical and other non-medical related emergencies, there's been a much higher demand, even more so than normal, placed on first responders. What can we do as citizens to minimize the impact on our local first responders? And I know that there have been some police departments that have been putting out notices that they are not going to send officers to respond to certain types of calls for service. Is there anything that we should we sort of stealth monitor that? Should we not be calling our first responders for things that we otherwise normally might? What are your thoughts on that?
Well, certainly you want to continue to call 911 anytime you have something that's absolutely critical and is an emergency. But certain things, there are people that will always call for a small cut on the hand or just general not feeling well. And they'll call an ambulance for that, first responders. Generally, that's not necessary. And especially in a time like this, when we're running up at capacity, those kind of calls are really not the best thing to do. So certainly take care of what you can at home first. And then, of course, if you have a true emergency and you need to call 911, do so, and we will come out. Many hospitals in the area are running at capacity. They're running up to that right now. So it's making it a little bit more difficult. When it gets to that point, they will start diverting to other areas. So accordingly, so take care of things at home best you can. Don't call 911 unless it's a true emergency. That's probably the biggest thing you can do right there.
Okay, great. Thank you so much.
So we have a question here. We've got a couple of questions from the audience. One is, how will we know if restrictions will be escalated like they've done in France? And you can answer, of course, for your specific region. Or do you anticipate escalation and further restrictions?
I can answer that first from here. In California, in certain cities where hotspots have started to show up, meaning they have had a bloom in cases, the response from each of the local cities that are affected by it is to increase restrictions. typical increases of restrictions are along the lines of there are areas where they're taking homeless people who are being quarantined, don't have any place else to go, and they've designated certain parts of town for that. And so they are responding to that by telling everybody else to stay away from those areas because those are open air areas that they're trying to keep these people in, again, because they have no place else to go. Some cities have enacted local ordinances that have to do with reducing the number of people that can get together that don't know each other or not family members down to you can't get together if it's two. And that is because of cases where people have gotten get-togethers and one of them happens to test positive for it, and then they have a bloom of additional people testing positive for it. Not everybody that gets that, of course, gets direly sick, but clearly this thing is very contagious. So wherever these hotspots have turned up, they tend to turn the heat up in terms of trying to keep people from getting even closer to a lesser degree than what is going on in the rest of the state.
Understood. Thank you so much. Joey, how about you on your end?
Well, we would hope that the conditions don't get worse, but I would think that if they do continue to increase as the cases go up and we get more and more people who are confirmed and have obvious symptoms, that they may have to tighten up the restrictions. I hope it doesn't come to that. I hope everybody is keeping distance and keeping their personal space very wide, and we don't get too many more.
To that point, Joey, someone said from Kansas City, Missouri, said, what are your thoughts on how floral shops, wig distribution companies, boutiques can still be in operation? How are these essential? And what are your thoughts on a 2-week serious lockdown for the United States?
Well, on a personal level, if we did a serious 2-week lockdown, I think it would help. It's not my call, and it would have serious economic issues as well. It would have to be very difficult for people to go out and get even so much as food and medications. So a lockdown is a very difficult thing to do. Would it be helpful? Probably.
All right.
Oh,
Awesome.
we also have some questions, mostly for first responders. Unfortunately, our first responders had to go respond to things. So people are asking about N95 masks, for example. And so we've seen a lot of debates on that online. So I was wondering if anyone can answer that here.
As far as the N95 masks are concerned, yes, they do help. They help a lot. As far as the surgical masks are concerned, that people are talking about surgical masks and wearing them now, those aren't going to really help you. The surgical mask is really more for somebody who is sick currently. If they're sick and they're wearing a surgical mask, their cough, their sneeze, what they're breathing won't go as far out into the room. Gives you less chance of getting sick from them. But as far as it protecting you, not so much.
Yeah, that's something that I've seen a lot, even locally in my areas. Now we're getting to the point where I'm starting to see people, with bandanas and so forth around their face. With my experience in military and some firefighting education, to me it always seemed interesting. It seemed odd that you would not have what we would call a positive pressure seal, So I was wondering about how N95 factors into that versus, again, surgical masks or like yard work masks you get from Home Depot and things like that. Is a pressure seal necessary for protection?
Is it necessary? Not necessarily, but it depends on how aerosolized it is in the particular room you're in. If it's aerosolized, somebody coughs, somebody sneezes, you got droplets in the air. It can go into your eye. It can go into your nose. It'll get onto your hand. You touch your face, your eyes, your nose, your mouth, and now it's in your system, and that's the concern.
All right, great. Thank you so much. Dave, you want to keep going on reader questions? You want me to?
Yeah, absolutely.
Okay.
So another this one comes from an anonymous attendee, said if there's an escalation in stay-at-home lockdown, is there a means of identifying why you're going to the grocery store or the pharmacy? And this is someone says in Oregon who they're home and they're high risk. So basically, like if it really becomes down to essential personnel, do you think we're going to turn into a show me your papers kind of situation? Some of my friends that are defense contractors got physical letters that said, hey, you're allowed to buy gasoline and you're allowed to be out, which, that is pretty concerning to people, that it could be pushed to that level, that those are being preempted and out. Do you foresee state borders shutting down and stuff like that?
Based on what's going on only in California, which is, you know, at this point, you kind of got to watch what's going on locally, because you're each state, each jurisdiction, each county has authority to set the rules the way that they need to. But out here, the fact of the matter is, we've got a country that's got millions of people in it, and we have to feed them. There's really no choice about that, and they have to be able to get the food. What I have seen has gone on is several of the stores have set aside times for people who are high risk to come in and shop, basically in the store alone. So there are times for the elderly now that are set aside during the day. There are times for first responders actually to go, and which is kind of interesting, because first responders, in that case, it's not that they are vulnerable, it's that they are far more exposed and far more likely to be carrying the virus as time goes on, because, you know, they're gonna touch society as essential workers out there. So they're potentially even greater vectors than the general population. So there's special times for them as well. I believe for the first responders, you have to show a badge to get into the store during that time, and then for the elderly, well, you know, or people with medical conditions, you know, that's basically a trust factor, and then everybody else kind of takes their turn. It's interesting. There are long lines coming out of the stores in California now with pylons in between spaces, and people are standing in between the pylons 6 feet apart. And amazingly enough, which is something about just how cooperative society the United States is, people quietly and patiently take their turn.
Speaking of stores, another user question. If you go out for groceries, should you wipe down all items as you bring them into the house? Basically, what should be the process that you do when you go out and then you come back in, you're bringing new and foreign items in to your home?
All right. Well, I'm actually using that process myself. Things that I have to wipe off, such as cold items, I wipe them off very well, even to the level of putting bleach on it outside before I bring it into the house. Other things that I'm bringing into the house, such as cans and boxes and things like that, I'm actually putting it into its own quarantine for a few days. I have an inside garage part attached to the house. I bring it into the garage and I'm leaving it in the bags. I'm not touching it. It's got to sit there for 3 to 5 days before I'll bring it into the residential part of the house. It's something not a lot of people are doing, and it's something probably people should be looking at. The people who are stocking the shelves, are they sick? Are they not sick? Are their kids at home sick and they're carrying it and they don't know? The other people who are shopping in the store, are they sick? Are they coughing? Are they sneezing? Are they just touching your cans and your boxes before you bring them home? It does take a little while for the virus to die off, and it varies depending on the surface, whether it's a cloth, a cardboard, a metallic surface. It can take hours to days, depending on the type of surface, before the virus is going to die. So you bring things home, quarantine it somewhere in your house. It could be a separate room, attached garage, a shed, something of that sort. Let it just sit for a couple of days and bring it in the house. If it's something you need to bring in the house right away, you may want to try a little bleach spray, watered down bleach, and bring that into the house after it's been completely wiped off.
Hey, Joey, I've actually got I got a quick tack on to the end of that question. You're talking about quarantining things inside, in a separate room or somewhere else in the house. Have you heard anything, or do you know anything about there being a temperature range, right? Can we throw something in the freezer, or can we throw something in the oven on low? And I mean, can we cook it off? Can we freeze it? Is there a threshold that will destroy the virus itself? Do we know?
In a general sense, yeah, high temperatures will do it. I don't think I want to go take my box of cereal and stick it in the oven and try and cook it out. However, putting it in the freezer may not be enough to kill it. You may end up putting something in the freezer and it just may be in a pause state and it may come back later. That part I'm not positive on.
Understood. Thank you.
Do we know how long it lasts on mail? Someone just asked about mail specifically, because you got to think about our letters and packages go through many different hands before they make it to our doorstep.
If you look at the mail carriers, the UPS delivery people, the Amazon delivery people, the clerks at the stores, they're all wearing gloves now. And they have been for, at least out here, they've been doing it for a week and a half. So I have not seen a delivery worker of any sort that does not have gloves on and does not have a mask on at this point.
Yeah, there is guidance from the CDC about how long things will last on different surfaces. So if you go onto the CDC website, I believe it's cdc.gov, you can look up all the coronavirus information, and it'll tell you, I know plastic materials in particular, it's about 3 days. That's on the long side. Metals was about a day to two, depending on the type of metal. Paper and other things were about a day. But certainly go and check it for your particular purposes.
And so, pardon me. So another question about talking about people in hazmat suits, and there it shows them spraying stuff down. Is that just a bleach spray, diluted bleach or something like that they're using to disinfect surfaces?
It depends on the agency. We are using a diluted bleach spray right now, but there are other chemical versions that will do the same thing, but not all of them work the same. Some need a longer soak time. Certain ones you have to let it sit wet for 10 minutes before it's good enough to use. Others, it's going to be more immediate kill.
We had another question here about law enforcement training in Utah. And someone said they're going to be doing training for law enforcement. And there's 3 people, including the instructor. If no one is feeling ill on the quarantine, if the quarantine is going to be over on the 30th in Utah, is it safe to train tomorrow if they maintain the 6-foot rule, or should people stay inside?
Well, it's not a simple question like that. For training, I would postpone it. For things that are of vital importance, you got to go out to a fire, to an EMS call. You got to go get your groceries. I would still go out and do those things. But you're going to be touching something. Maybe one of the people there is sick. You're going to be touching your weapon. You're going to be touching a wall. The person behind you is going to touch the same thing. Somebody else is going to touch it. And all it takes is for you to touch one of those surfaces and then go to your eyes, your nose, your mouth, and you've now ingested it, and you're potentially going to get sick.
Tom, we also had a suggestion that you re-intro our panelists for people that didn't join us right at the top.
I actually just saw that pop up. Thank you very much. So for those of us who joined us a little late, here we are with the first ever RECOIL Offgrid live stream webinar, Pandemic and the Path Forward. Obviously talking about some of the COVID-19 concerns that people have. We have 2 subject matter experts on the line with us today. And I'll have them go do a quick intro again. Joey, just give us a real brief rundown.
My name is Joe Nickisher. I am a retired detective in the New York City Police Department. I currently serve as a chief in my local volunteer fire department. We are about 1 hour north of New York City in the Hudson Valley.
Thank you so much. Dennis?
Yeah, I'm Dennis Santiago. I'm out here in Los Angeles, California. My primary area of expertise for this session is in the area of cybersecurity. Basically, I got asked to be on the panel because of questions that might arise having to do with people being at home, working from home, children going to school from home, and what's happening on the internet and what it is that people need to look out for, because we are in an alternate lifestyle at this point in time.
Thank you so much. And for those of you that tuned in from the very beginning, thanks for being patient. We have a lot of people that are joining in progress. We'll probably take a break and do that a couple more times throughout. So thank you guys for that. Speaking of the cybersecurity angle, Dennis, I do want to shift gears here real quick and direct a question straight to you. As you said, we have a lot of people at home, particularly we have a lot of people working at home who maybe are not used to that type of environment. So for those who are working from home, what precautions do you suggest that people take on their digital footprint when they're working remotely in order to protect potentially sensitive information, personal information, or corporate trade information that may be transmitted back and forth from a remote work type environment?
Yes. Well, yeah, and that's kind of a biggie right now, because the internet is kind of a dangerous place as far as information is concerned. You know, in the world of don't let a crisis go to waste, there's nothing out there that wants to take advantage of a crisis more than a hacker. And so you have to be careful with that. One of the things, because people suddenly had to go to work from home, you have to remember that once you leave your office, all of the protective layers that your corporate IT people have put into place to protect the building that you work in are no longer in place. You basically don't have the firewalls. You don't have the intercepts and the mail. Your mail checking systems may or may not be the same as what you had on your office computer, and so now you're kind of on your own. Most people that are working from home will have just basic connection equipment. They don't typically have a firewall appliance that is there. It's possible that you have a router in your house, and that will help protect you somewhat because it insulates you from the raw internet. But you have to be careful with where you are right now, particularly with when you're doing corporate work, because if you transmit stuff in a mode that you're not using a virtual private network, if your work hasn't set up for that, you need to make sure that your firewall is on in your computer, and and if you don't know that it is, you probably should be asking your IT people for guidance as to what you can do, because hackers will try to break in to all of this stuff. And and you're also on your home network, which means you're probably sharing it with the computers for your kids, who may or may not be using the same computer that you are. If they are, and you have a second one, you may want to do your work only on one and have a computer for everybody else in the house on theirs, firewalls active inside both computers. These are adaptations to the times that have to do with the fact that you are, kind of flying naked on the internet at this point.
What are your thoughts on apps and programs like Signal or other commercially available, encrypted or quasi-encrypted transmission systems?
Oh, those kinds of applications are actually very, very good. And the apps, particularly on phones, both the Android and the Apple version of phones that are widely out there, they're naturally protective of themselves. They know they have a lot more security stuff in them by nature than your desktop or laptop computer. The use of applications like Signal, like WhatsApp, and others that have a natural encryption built into their communications, Skype, are the kinds of things that you should be using to connect with the office. If you are with a larger corporation, you're probably already using some sort of voice over IP network that your company has configured. That may or may not. It's usually also has good security inside it. What they are finding, though, is because these corporate services that have been out there with so many people working from home, is that they're getting overloaded, and they're capping out in terms of what they can support in terms of the number of users, because they weren't designed for this much load. And so people are dropping out of that and going back to less secure means just to stay in touch with each other. It's something really for people and companies to start to take a look at and figure out, geez, do you really want to keep the volume up, or do you want to pull it back? It's an unknown as to how quickly some of these companies that provide these kinds of secure pathway services can bring up their capacity to serve all of the companies and all of the people that are working from home now. But again, we're a week and a half into this, and we're kind of learning as we go along, to tell you the truth.
Oh, thank you very much for that, Dave. I'm seeing a lot of chat and Q&A start to pile up.
Yep.
You got a couple for us?
Actually, I do, and I see that Dr. Robert Riley, you've joined us. So we did lose a couple of panelists because our first responders, were responding first. So, Dr. Riley, why don't you introduce yourself and give a brief breakdown and why you're scrubbed up right now.
Hi, thank you for having me. Sorry for being late there. I had a little emergency. Can you hear me okay?
Got you just fine.
Good. So I'm the director of cardiac surgery for a 5-hospital network in the Southeast, and I've been asked to participate in this conference due to the fact that we are actively treating patients with the COVID-19 virus. And in fact, I have one person right now, as we speak, on extracorporeal life support, or ECMO, to support their respiratory function while they are suffering from severe pneumonia.
Great. Thank you so much for that intro. Dave, you want to kick us a couple of questions?
Oh, absolutely. So one of the main concerns that people have always talked about is, the number of ventilators and the number of ICU beds that we have. Are you currently seeing a surge on your beds at your facilities, and then everyone else regionally? Are we reaching hospital capacity at the moment?
Currently in the Southwest, we are not at hospital capacity. We are seeing more and more patients admitted with the diagnosis. We're testing more, so we're obviously going to see more patients with confirmed cases. Where I stand right now, we only have about 300 patients in the entire state diagnosed. Up to date, we have 2 patients who have died from the disease. And like I said, we have 1 patient on extracorporeal life support out of 29 worldwide. Ventilated patients, we are still below our capacity. We have stopped all elective admissions to the hospital and all elective surgery at the request of the Surgeon General and our medical societies in order to reserve or preserve resources and keep availability open for an anticipated surge in patient volume.
Excellent. Thank you very much. And Dennis, to your point earlier about people going wild on the internet, and the internet is great because everyone can have an opinion, and the internet is awful because everyone also has an opinion. So we have a lot of people asking questions right now that are just kind of myth busting or just trying to be sure. And someone just said they saw an article today that the soles of their shoes can harbor the virus for days. What else can you recommend besides taking off your shoes before entering the house? Joey, I know that you answered some of that, but then people are also asking about, would just sunglasses help because it stops droplet from the eyes, and can someone break that down for us about what people should be doing?
Well, let me start with that, and that with everybody being home and everybody being cooped up, and the primary source of relieving oneself of cabin fever being the internet these days, you have to be really careful on the internet, and you have to basically go to quadruple checking everything that you look at, even if it looks like it's official. The amount of misinformation that is currently circulating around the internet is, it's just absolute noise factor. You'll see things that will beguile your eye. If it looks like it is attracting your eye too much, it's probably clickbait. And you need to, so anything that looks too good to be true, or anything that looks too attractive or seems to trigger you, I'd be suspicious of that right off the bat. If you will note official sources, they tend to downplay the energy of what is going on. So if you see somebody that sounds like they're a chicken with their head cut off, they probably are one. And so at this point in time, whenever you see something, take the extra time to look it up. If you think it's something that's important to you, take the extra time, punch it into your Google or punch it into whatever search engine you want, and find more things to see whether or not that information is collaborated. Because what you don't want to do is start to adopt techniques that are going to be counterproductive to what you really ought to be doing. Cannot overemphasize that enough. There is a level of maneuvering that is going on the internet, even by governments, state versus federal, state versus state, allocation of resources, how much is actually being overloaded where. And so part of that is the theater of energy that goes along with something like this. This is a crisis we haven't seen in a century. I mean, the last time that the world was beset by this was when the Spanish flu was around in 1918, which interestingly enough is, almost exactly the same amount of time ago, almost at a century, this stuff seems to happen. But yet you've got the resources. Take the time to use the resources right now and get at least 3 or 4 confirmations on something before you act on it, because you want to be sure.
And I'd actually like to ask everybody, all the panelists, what are your primary go-to sources of information regarding COVID-19? Or is it official? Where do you go? Where do you guys go to find out the latest and best information?
Okay, well, I'll tell you where I go. There's a site on Johns Hopkins University that gives you a map in real time of the cases as they erupt. I mean, literally within seconds. So I go there and I watch what's going on. I do watch all of the major news bureaus, and I don't just watch one because I like the political bent of it versus another. They're all trying to cover things as well as best as they can right now. It is a good thing to check the television at least once a day whenever your governor comes on and makes an address and says something. And then it's also an important thing to scour the internet from the point of view of trying to find where the real information is. Again, with that jaundiced eye, there's a lot of good information that's out there. The researchers put a lot of good information out there, but again, that emphasis on verify it 4 times, because you don't want to hit the enable switch on whatever it is that you're going to do and then find out later that you've made the exact wrong decision.
I would echo those sources. I use the World Health Organization and the CDC, as well as my society websites that actually do direct me to the Johns Hopkins website, as well as the ones I mentioned.
Joey?
My primary sources are also official. We'll get stuff, of course, from the town, from the county, and from the state. So that's where I'm getting the majority of my information. And things that I need extra information on, I will go to some of the official sites. The CDC, of course, under New York State, we have Department of Health. Under the county, we have Department of Health, and I'll get their official word as well. The map that was shown earlier, I'm also using that one. It is pretty close to my official numbers that I'm getting. So that's a good idea of where we are as far as how many numbers.
Joey, this one is to you. How's crime rates looking in the affected areas right now? Because locally, we've seen actually like reductions in domestic violence in some of our suburbs, which is very different than in what's been happening in Arizona. So what is it like in your neck of the woods?
Surprisingly, crime is down. New York City, which is, of course, one of the big hallmarks, crime is down generally across the board, which is fantastic. New York City is actually having a big issue with the police and fire coming down with coronavirus. As of yesterday, there was 236 police officers in New York City confirmed with coronavirus, and 3,200 and up have called out sick currently from coronavirus. Thankfully, there's somewhere in the neighborhood of 35,000 police officers in New York City Police Department, and the crime rate has been holding steady. Well, I should say holding steady. It's been going down and has not gone up, which some people are fearful of.
Dr. Riley, is there any concern about running out of medical equipment or running low on medical equipment? I know there's a lot of talk about surgical masks and N95s, and I know there's a lot of grandmas making cotton masks right now, and I couldn't even buy elastic at Walmart. So
there's definitely concern. We're all worried about a surge in patients to exceed our supply. Right now, we are being judicious in using them. We are conserving who is able to put a mask and gown on. We're limiting all unnecessary personnel from operating rooms and even from the clinics. We're doing a lot of virtual or telemedicine visits instead of seeing patients in person. So we're definitely concerned about it, ranging from gloves to gowns to masks and, like you mentioned earlier, ventilators.
I'm gonna go ahead and shift gears here just a little bit. Dr. Riley, this one is for you specifically. This is a question that I've kind of had from the beginning, and has been echoed by some other people that have come to me with this question. Dennis brought up the 1918 Spanish flu, which of course is probably the last time we saw something on a scale like this. Having said that, in the last decade or so, this is not exactly our first rodeo when it comes to viral infections. There's been SARS and bird flu and swine flu and H1N1, and I personally can't remember anything even remotely close to this level of response to any of those. So I guess for me, the question that comes out of that is, what makes COVID-19 so much different from everything else we've seen in the last 10 to 15 years that warrants this sort of, the shelter in places and the lockdowns and the concerns about, overloading the infrastructure?
That's a great question. So I have to give the caveat here that I'm not an epidemiologist or an infectious disease doctor. I am a heart surgeon. But to clarify, first of all, COVID-19 or the coronavirus is exactly what the SARS virus was. So this is technically called SARS-2-CoV-2. So it's a second version of SARS. So it just so happened to occur at the same time where we're at peak influenza season and the peak of the COVID-19 outbreak coincide. What makes it different? There's political reasons, there's social media reasons, and then infectious reasons that make it different. We're definitely more aware of the disease. It appears to be very easily transmitted from person to person and has a fairly high rate of death rate associated with it, especially if you have a pre-existing condition. If you're older than 80, if you have diabetes or hypertension, or if you smoke, those are the things that we know increase your risk of having a bad outcome with this. That's a little bit different than the flu. They still have all the same risk factors, but it seems to be a little bit easier to transmit from person to person.
Excellent. Thank you so much. Or do you have more? So please, if you have more, go for it.
Yeah, this is not to be hysterical, but one of the more challenging problems with this is we hear the data from Italy that basically all of the people that are dying are average age around 79 to 80. But there is some data that suggests that there's a large number of people between 20 and 50 who are getting infected and coming to the emergency room or requiring ICU beds or even ventilators. They're not dying at the same rate as the 80-year-olds, but they are definitely getting sick.
So probably when we're seeing someone that says, I got it, wasn't a big deal, it was the sniffles, those are probably not people that were actually tested and then confirmed to have had the disease. So it's kind of a positive feedback loop. Same thing that conspiracy theorists do, really, realistically.
Right. So there's a lot of people that are calling 911 with headaches and coughs and low-grade temperatures that are just the common cold. I would say that our first 100 patients that we tested, we only had 5 positive.
Gotcha. Another question from the audience here. Someone from anonymous attendee says, Utah here, we've seen a huge uptick in sales of ammo and guns and more. And of course, we've written about that on the RECOIL website of the house. And said, what have you seen in states like New York and California, of course, to your region, insofar as crime, looting, and grocery stores?
And is home defense is reducing more about the infection, I guess.
What crimes are you seeing more and less of? Joey, can you speak to that?
Your audio cut out. Can you repeat the question?
Yes, I just got to, yeah.
Right now, as I was doing this. All right, so people are asking about are we seeing any increase in crime and looting and robberies, or is that not happening because people are coming together? And there's also a lot of jails have emptied as well, and a lot of people are concerned about that.
Well, as far as the crime and the looting, we have not seen that at this point, which is a fantastic thing. Certainly people are worried about it. As far as the gun shops, there were several that were selling ammo quite readily. But I know here locally, I've been hearing they're stopping the licensing process, so that no new sales are going to be done in many states, is what I'm hearing.
So in California, I have not heard that there has been an uptick in crime. Nearest week there is additional buying of firearms and ammunition that is going on, and it is, but no more so than any other crisis where when people get nervous, the stuff acts kind of like a crutch, and it just makes you feel better that if anything goes wrong, it's kind of like hoarding food. So there is that is going on as well. Ultimately, it doesn't seem to really be impacting what is going on the ground at this point in time. People are mostly, behaving. So we have not seen that point where social distress has come to the fore. There is a worry about it in that if people run out of money and the ability to survive, then things could get a little bit more desperate. But so far that has not happened, and nearest I can tell, everybody in the community and in government, at least out here in California, is working to keep things calm. So I've got a very positive attitude about the ability of just everyday Americans to hold things together.
Excellent, excellent. So we're getting a lot of questions about people worried about their everyday routines. And Joey, you talked about your routine from a grocery store, but for let's say you're an urban apartment dweller and you're going to go and we're going to mask up, we're going to go buy groceries, and you're going to come back. A lot of people are wondering about what is a standard ratio from bleach to water to spray on stuff. And then if you don't have the ability to segregate your supplies, which you thankfully do, if someone doesn't have that ability, what should people be doing when you come home from the grocery store?
Well, as far as if people want to take care of their groceries and clean everything off, the ratio is about 5 or 10 drops of bleach per gallon. Again, I would recommend that everybody look it up. Go onto the CDC website, go onto your state health site or your local county health site and see their specific recommendations for the ratio. But it is a relatively small amount of bleach. Robert might be able to answer more off the top of his head the exact ratio. But just on a cloth, you can wipe everything down and rinse off the cloth, of course, when you're done. And anything that might have been on your cans and your containers should be taken care of at that point.
Excellent. I have another follow-up here. Robert, this one will be for you. It says, if a family member or I am suffering from symptoms of COVID-19, but the symptoms are manageable at home, should I still go in to take a test? If people who are asymptomatic or with mild symptoms don't get tested, doesn't that skew the statistics on severity and mortality?
So the statistics are definitely skewed by who gets tested. The answer to, if you have symptoms but are not feeling ill or overly struggling to breathe or feel like you're drowning, then the answer is to stay home. In our state, we're only testing people that are suffering to the point that they feel like they need to come to the hospital. We have a few drive-through testing sites being established, but they're not full up and running as they are in other states. So if you feel like you have a minor case, stay home and stay away from people is still the current recommendation.
Awesome, thank you. I'm gonna pop in here real quick with a couple of technical notes. The first being,
if I could follow up real quick, just on
Yeah.
the people were asking about the proper ratio.
Go for it.
If I can do a screen share here, I actually have it up on my screen from the CDC website. Are you guys getting that at all?
Yep.
Sure if that's...
Yep.
All right.
We can see that.
All right. So according to the CDC website, 1 tablespoon of bleach per 1 gallon of water. So that'll give you a sanitizing solution. So you can just Google it. It was the second or the third link that came up under Google.
Excellent. Thank you so much for that. That is always good to get it straight from the source. So I appreciate that. Like I said, technical notes real quick. I got 2 of them. The first one being, if you are watching through the Zoom meeting link that was made available, you should be able to go into your chat window, and we have a link to a free download of an issue of Offgrid magazine. We've been pushing out a couple of different free downloads and making stories available that are relevant to what's going on right now. Everybody who joins is entitled to that link. Please go for it, download it, share it with your friends, and try and spread the word, spread good information, as we've already talked about. There's a lot of misinformation and a lot of panic information being put out. So hopefully we can do our part to clear some of that up for you guys. The second note is that we had originally a lot of this broadcast for an hour. We are 50 minutes in right now, and I still see tons of questions, lots of viewer concerns, which is fantastic. We were able to extend the broadcast by about 30 minutes. So as long as the panelists are on board and able to participate, we're going to keep this going a little longer and try and get to as many questions and comments as we can. So with that, Dave, if you want to pull one or two more, let's keep going.
Yeah, absolutely. Hold on here. All right, Dennis, this one is for you. What do you think is going to happen with the economy and the stock market, and what are our long-term effects?
Okay, so the economy, well, the stock market is tanking. That's very clear. But here's my view on that. You know, my day job is in finance and banking, so I have to watch this kind of stuff. So, you know, it's not an entirely off the wall question. I think people need to look at the stock market of the United States. Think of it as a battery, all right? So for the last 3.5 years, we've had a growing economy, and we've charged up the battery, and it's got a lot of energy in it. And we've hit a bump in the road. You know, basically, if you think of that battery as a rainy day fund, we are now starting to spend that rainy day fund on something that is very important to this country to deal with. And from that point of view, you know, the fact that we are entering into this situation with an economy that was fat and happy is an advantage for us. In that it gives us the ability to react to this and be able to pay for things. It gives us the ability to set up very, very aggressive forms of economic aid that will keep the economy going. And it gives us the ability to plan forward on what we need to do to restart the economy in the aftermath of this. You know, basically pre-stage stuff for what happens after this episode is over. We're pretty uniquely advantaged in that. And really on this planet, there are really only two economies that have that much money available and backed up. And they happen to be China and the United States, both of which have $16 trillion economies. That's our annual GDP. So, and both countries are preparing to spend that money in order to tackle this crisis. We're doing it now in a responsive mode, which is, I think we're past the market panic that was right up until this thing just basically got real. I think it got real this week with, or in the last week with the beginnings of the closures for people. So it's become something that is impacting the Main Street side of the economy far more this week than the Wall Street side of the economy. And you can see all of our government apparatus turning towards solving the Main Street problem. Now, and that's changing the way we work. It's changing what we focus on in terms of the things that we are working on. We're seeing auto companies changing away from creating subassembly parts for automobiles and going into looking at manufacturing ventilators. This is a change in what we're doing, and we're adapting. We're seeing a surge in the need for part-time workers that are needed to fill in the delivery part of our economy, because we've gone from going to stores to having stores bring stuff to us. And all of this is, these are changes to the economy that we're adapting to, and it's costing us some money. And, so we've lost maybe a third of the value of the stock market so far. We're probably going to lose more before it's done. But, everybody that looks at this says that once we get past this episode, we're probably going to bounce right back. How fast we bounce back really depends on whether or not our government holds its feet to itself to the fire to make sure that it has a good plan for coming back, and it has a unified plan for coming back. So in terms of the risk to our economy is if we don't have all of the leadership of this company learning to pull together, and it's going to take everybody in this country basically saying, stop with the noise, and you got work to do, and we expect you to do it. You know, that's kind of where the pressure from the public needs to be coming from right now. And the way we can assure that as a people really is we have the power of the internet because we're still connected to each other, and we can start to ask for those things and ask those kinds of questions of not just the national leaders, but the states, because they're going to have to respond as well. And the municipalities are going to have to respond as well. And the financial system is going to have to respond. It's not that we don't have the tools, it's whether or not we use the tools properly.
Yeah, I mean, long road ahead, and you're definitely talking about second and third order effects here. This one is for you. How long do you anticipate this to last? What we're doing right now, or shelter in place and all that, how long do you anticipate will be like this?
On the first responder end, we're certainly expecting several weeks. It could be as long as mid-April, late April. Personally, I do think it's going to go a little bit longer than that before we really do a good bounce back, but it's going to be very dependent on whether they're able to develop a vaccine and if the medications that they're currently experimenting with, if they work or not.
Dr. Riley, I'd be curious to hear your standpoint from the medical side of it. I don't know what numbers you guys are looking at in terms of how long we're thinking this is going to go. Lots of people are talking about flattening the curve. That is obviously a process. So any thoughts you might have in terms of a duration for the conditions we're seeing right now would be really helpful.
Okay, so I think that we're seeing lots of different data, and it's hard to synthesize it all, like you've mentioned. So flattening the curve basically does not decrease the number of people that are infected. It just stretches it out so that we can deal with the infected people in a reasonable way without stripping our supply. So if you take a look at the world, we're about 2 weeks behind Italy. So where they were 2 weeks ago, they were overwhelmed with their healthcare system, ventilator beds and ICU beds. So we were kind of expecting the peak around the end of this week, early next week. It looks like we did flatten the curve a little bit, and it's going to be a little bit longer than that. So I would think that it's going to be shelter in place for probably at least 2 more weeks before we start relaxing some of the restrictions.
Yeah.
Great, thank you.
Hey, I'll make that personal from my end in terms of where there's. I haven't seen either one of my 2 daughters for about a week now because they are both self-isolating. You know, my one daughter worked in retail, but that didn't expose her to it. What exposed her to it was that her boyfriend's family was part of a church, and that church happened to have a get-together at the wrong point in time, and one of the people there came up with this disease, and so everybody there was alerted to it, and they all went into self-isolation. So you know, she's staying with her boyfriend's family, and they're basically staying together there. My other daughter, who is a therapist, a psychologist, had one of the families that she works with call her up and say that they had just taken the tests. And as the good doctor knows, if you are accepted to take the test, given because there's criteria before they'll give you the test, that means there's already suspicion that, yeah, this may be something there. And she's waiting for those tests to come back, and she went into self-isolation and is now working remotely with all of her patients. So, and the point of that is, let's say the 14 or 21 days goes by and they don't have anything and they come out of those cocoons. It starts to cycle all over again, because it just means that they didn't get it for that exposure, but they could still get it for the next round of exposures. And So there is the reality that once this process starts, until we get to the point that we have either had enough of this circulate through the entire population, that it's harder for the virus to find something to jump to, or we come up with a cure, which is not something that's going to happen anytime soon. We're all going to have to remain diligent and just aware of the fact that individually, you know, if something comes up, you have to be proactive, not just for yourself, but for everybody else.
Are sports
So
games?
I'd like to add to that.
Sorry.
That's okay. So I wanted to just kind of add to that to emphasize that there are really two reasons to do this. Number one is to protect yourself and to protect patients, not to transmit the disease. The other is to preserve resources. And if you can slow the spread or delay the number of people that get it, we might not have a cure, but we could come up with a vaccine before a cure. So in the H1N1 days, that's kind of what happened. We were able to get the vaccine before we ever contemplated a cure. And that way we didn't overwhelm the system like we did worldwide. Here locally, we were overwhelmed with H1N1 in ventilators and in extracorporeal life support. And that's what we're trying to avoid.
Is this the end of large sporting events and rock concerts? And I mean, has the face of the globe changed? Is this going to be as significant as 9/11 was to the United States, but worldwide?
In the short term, it's certainly going to be that. For a while, we need to isolate each other. We need to flatten that curve. As was mentioned, we're just buying time so that we can get the appropriate supplies we need. We could treat everybody if we have 2 or 3 years to treat them. If everybody wants to go tomorrow, we don't have those kind of resources. So for the time being, yeah, you need to stay away. You need to isolate to a large degree. But given time, whether it's 2 months, 4 months, 6 months, at some point things will start going back to normal. But we need to have a lot of things in place.
Yeah, I kind of laugh about that, and that when you look at this, what happens next? If you go back to the Spanish flu, which was 1918 to 1920, right? So it was a bad time on the planet. It was right after World War I, and so people were still reeling from that. But in the aftermath of it, what happened in the world, and in the United States in particular, we had the Roaring '20s, which was one big, huge party. And yeah, things look a little dire in the moment, but all episodes passed, and the sun will rise again, and everybody that is on the other side of it will probably follow the exact same sociological path that we had in the 1920s, and it'll be a time to just celebrate being alive. And so kind of look forward to that. This is not the end of the world.
I mean, that is something that we've seen just in disasters around the world, and we saw it in the Balkans. And when the world goes to hell, people do come together. People stick together pretty well, and we've seen some increase in that, and I think that might be part of the reason why we haven't seen a tremendous increase in crime. Although, Joey, maybe this would be for you. Is it just that we're not enforcing it? Is that it? Because we know that like Cleveland has a list of crimes they won't respond to anymore, and people saw breaking and entering and freaked out because they thought, oh, someone's in my house, the cops won't come. They will come to like an active B&E. But if you come across like someone broke into your shed and stole your lawnmower, they're like, call the police, make a report, officers won't respond. So are we perhaps just seeing fewer police officers respond rather than a crime rate, staying the same or flattening?
Well, certainly some of that is speculative at this point. But I think with a lot of people staying home and staying local, you're not getting a lot of people out to commit these crimes. And there's certainly going to be less victims on the street for, let's say, for a robbery. The people aren't there. There's people home, so there's going to be less burglaries because people aren't at work. So certainly a lot of that has a correlation there. Again, I'm very thankful that we're not seeing the looting issues that people are very concerned with. We're not seeing that at this point, and hopefully it'll never come to that.
It does kind of remind me a little bit of wintertime. In St. Louis, famously, murders go way down as soon as there's any snow. But when spring hits, then that's when they go out and they shoot people. So I can definitely see that as well. Dr. Robert, it said, what's happening with collecting antibodies from healed COVID-19 persons and use for a cure? Can you kind of give us the dumb version of that? I know you're an epidemiologist.
So I think that when you go through an infection and recover, you develop antibodies. And the idea is to take plasma from these folks and give them to other patients, other people, and let those antibodies work as sort of a vaccine. New York has kind of started the experimenting with this, but it's only in the early stages.
What about the use of antimalarials and then HIV treatment? Malarial drugs and HIV treatments that we've been hearing so much about. And famously, the governor of Utah said no, and other people said no, and other people.
I guess I'd start with don't do what a gentleman in my state did, which is take fishbowl cleaner that has a cousin to the antimalarial drugs. That's not effective and not safe. I think that there's no significant body of evidence right now that it is helpful, but it is being looked at.
And also, someone just asked on Facebook Live for everyone to be reintroduced because they joined us late. So, Tom.
Yeah, absolutely. Again, we'll take another a quick pause here just to go around the room one more time. Here we are on our very first RECOIL Offgrid live stream webinar. We have a panel of experts with us, subject matter experts from a couple of different walks of life that hopefully are bringing good information for you guys in regard to COVID-19, the virus itself, and how to better protect yourselves. Dr. Robert, let's start with you, as you were the last one in. So let's have you just give a quick rundown of who you are and where you're coming from.
Robert Riley, I'm a cardiac surgeon, heart surgeon in the Southwest. I'm the director of a 6-hospital network, and I've treated COVID-19 patients who have ranged from mild flu-like symptoms to severe respiratory distress, including placing them on artificial heart machines to circulate their blood called ECMO.
Excellent, thank you. Joey, how about you?
My name's Joe. I'm a retired detective, New York City Police Department. I currently serve as the chief of my local volunteer fire department. We are about an hour north of New York City in the Hudson Valley.
Excellent, thank you. And Dennis?
Hi, I'm Dennis Santiago. I am here today to provide what I have in terms of expertise on the internet, cybersecurity, and also apparently some questions that occurred earlier on the economy and finance and banking, because I work in that industry as my day job.
Excellent. Thank you guys so much. Dr. Robert, I actually have a question for you. Obviously most restaurants across the country have ceased any kind of dine-in service. And a lot of these places are going to takeout and delivery only. My question is, in terms of preventing community spread, a lot of people want to patronize, especially local small businesses that are really struggling during this time. What do you perceive as the level of risk for people in terms of takeout, carry-out type dining?
It's a tough question. I think the risk is generally low. The problem is that you can't pre-screen everybody that's delivering your food or who's coming to your window. So if you are exhibiting signs and symptoms, then you should not be frequenting even the drive-throughs or working in the drive-through. And that's the hard thing to enforce. If everybody kind of pays attention to the rules, I think it's generally safe. Ian and I did that this past Sunday, so I think that I'm following the rules, but I have done some takeout.
Awesome. Thank you so much for that.
People are
Dave,
asking,
we got anything coming in from the audience?
Yep. People are asking about Z-Paks, and because people are talking about, isn't it an antibiotic, and how could that possibly work against a virus?
It does not work for as an antiviral, but I do know that people are using the Zithromax or the Z-Packs, prescribing them probably to keep secondary infections down. As you know, when your immune system is down, you're susceptible to all sorts of infections, and they are cumulative. If you have one problem, the next one is going to be worse than the first.
Well, that is one thing that I've seen discussed a little bit. I mean, any problem that you have right now is just compounded. If I fall off my bicycle and I break my arm right now, it is 20 times harder to deal with now than it was, 3 weeks ago. And not only that, I'm not going to be a priority. I'm going to be in a place where there are a bunch of actively sick people there. And, I just broke my arm and need it set. So I do understand that, what you're saying with that. And then someone's asking about, said, Robert, can prednisone via doctor's orders be used at home to ease non-critical respiratory symptoms? Kind of sounds like you should ask his doctor. But.
Yeah, I'll go with ask your doctor, but that's a double-edged sword, because if you truly do have an infection, the prednisone does suppress your immune system, so it could make it flare even worse. I would not recommend that without a specific diagnosis and treatment from your personal physician.
All right, someone just asked, do you all, well, people are saying, do you think people will be congregating in church by Easter, like the president said? Do you think that is what the reality that we're going to see?
I think that's purely speculative at this point. There will be some places that no matter what happens, if they're going to congregate, they're going to get together. I'm reading reports at how different religious institutions are still holding services. Weddings have occurred this week, and people are having gatherings of people at weddings. Funerals continue to go on. My own other half was at a funeral earlier this week. It was much lower turnout than we expected it to be, which it's nice on the safety end, and it's terrible for the family of the deceased. But it's certainly something that it's going to be on a case-by-case basis depending on your region and what's going on.
Yeah, for me personally, my grandmother passed 10 days ago or so, not from COVID, just from congestive heart failure, and she was 89 years old. Lived a long, great life, but her funeral's been put off for, I don't know, we're going to have one after all this is over at some point in time, and that's just how we're going to do it at this point, because getting people to travel from different states and putting them all together just doesn't seem like a great idea at the moment.
Joey, I've got a question for you. So one of the things that has come up a couple times in this discussion is how refreshing it's been to see that there hasn't been a massive spike in any kind of civil unrest, and that people are really trying to come together. Like I said to the doctor before, there's lots and lots of stuff on social media about people wanting to pitch in to help, whether it's patronizing their local businesses or whatever. In terms of people who may want to assist first responders, I know you're with a volunteer fire department, and Dennis, I know you said you're a volunteer firefighter as well. But Joey, for you, in terms of people who maybe now feel like, well, maybe I can do something, maybe I can do my part. On your end, are you seeing departments and agencies that are people looking for volunteers, or is this maybe one of those times that even well-meaning citizens might want to sit this one out for a little bit?
Again, that's something that's going to vary by location. In my department in particular, no, we're doing okay as far as manpower is concerned. But I have heard that at some level, some of the hospitals are looking for extra staff to come in and assist with a few things, I believe on the clerical end and the stockpiling. I know even the state has been looking for people to volunteer to do some administrative tasks for them to assist with that. So I would say if that's something that people are interested in doing, certainly reach out. Local level is always the best way to start. So start with your town or village, look at your county, then your state.
Doctor, your thoughts on that in terms of from the hospital and the clinical aspect, please.
Would you repeat the question, please? Sorry about that.
No, that's okay. Talking about people who want to rally and come together, perhaps people who maybe want to volunteer or chip in at either a fire department or police department, or in your case in a hospital or clinical setting. Would you say that you guys are kind of looking for all hands, able-bodied people, or is this maybe something that well-meaning citizens might want to just sort of sit back and let the professionals handle this?
We're currently recommending sit back and let the professional trained people handle this. We have a very large volunteer population in our hospital. They've all been sent home for about 2 weeks now. We've sent home medical students and even trained doctors in training, the residents. So we're trying to limit as many people to exposure as possible. I would not recommend someone who's not trained volunteering. One of our biggest concerns is the statistics out of Italy suggest maybe 8% of all infected patients are healthcare providers. So we definitely want to limit the exposure to those trained who know how to protect themselves and wear the protective gear appropriately.
Thank you
And
so much for that.
I'll add to that. So I'm not a volunteer at a fire department. I'm a volunteer at a police department. And what I do there, I act as a part of the range training staff. The entire volunteer program at the police department I work with has been shut down, very similar to what the doctor was talking about in terms of getting all non-essential personnel out of harm's way, because the personnel that are working are extraordinarily exposed to this. And, so they're taking a risk. I mean, it is really a heroic thing to be out there on the front line of this thing right now. But we've taken, at the department I work with, all the non-essential personnel and gotten them out of the way for the time being because it's just too much of a risk. They don't have the same degree of equipment that the people that are, that are in the cars in terms of masks, gloves, procedures, daily briefings of exactly what to do, briefing by briefing basis. The police department I work with is doing their briefings in the parking lot with everybody standing 6 feet apart for the entire daily briefing for shift to shift to shift. And this is the kind of stuff that they've adapted to. And so it's better to, and it's easier at the moment for the frontline pros to have that territory all to themselves to get their job done more efficiently. There has been a call for, interestingly enough, not from the first responder part of the world out here in California, but from the infrastructural responder part of the world, where you have the organizations that say deliver food to people that are shut in at home and can't get out, older populations and that type of stuff. So, which is really, you take the food, you pick it up, you drop it off out the front door, and they come out and pick it up themselves, but they can't go back and forth across town anymore. So there is a need for that kind of stuff. So, but those are not the first responder agencies that are doing that kind of stuff. It's more like your Lions, your Rotaries, and those types of organizations that assist in that part of the world that are taking that role, and they could use some help. So if you're going to contact anybody, you probably want to contact people over there to see if they need any help.
Excellent. Thank you so much. Dave, I'm looking at the clock. We got about 2 to 3 minutes left. Do you want to pull one or two more from the audience, please?
I got two to pull here. First one is actually for you, Tom. It said, "Are you drinking a Monster Energy drink while you smoke a cigar? Gross."
I am not drinking it. I try to stay away from energy drinks as much as I can. But for those of you who know me out there, you'd know that it would not be a Tom Marshall live stream webinar if there was not a cigar at some point. So, but no, that is not an energy drink. Thank you for asking.
And then the other question is there a risk to healthy children playing together with children from other families, such as in a neighborhood park, so long as the adults maintain their social distancing?
So I answered that in the response. The problem is that the children are generally asymptomatic. Very few children exhibit signs and symptoms to the extent that an adult will, but they can be asymptomatic carriers and spread it to each other and to the adults that they go home with. So they should be isolated as well as best possible.
Thank you so much for that answer. And I think that just about does it for us. First of all, I'd like to thank all the panelists who were able to make it. Dennis, Joey, Robert, thank you guys so much for giving us your time and your knowledge. You guys are helping a lot of people out there who, you know, are rightfully so very worried. A lot of concerns and a lot of misinformation going around out there. So hopefully we were able to dispel that. And then for those of you all in the audience, whether it was through Zoom or Facebook Live, again, we really appreciate your participation. Hopefully we were able to answer some of your questions. If we didn't get to your question, you know, hopefully we're looking to keep doing these in the future. And so just keep your eye on RECOIL Offgrid, RECOIL social media, website, however you choose to follow us. Again, in the chat window for Zoom, there is a free download for an issue of Offgrid magazine. And then just like I said, keep following us and we're going to keep putting out the best information we can get our hands on. So thank you again for everybody. I hope this was helpful. And if you have any feedback for us, again, you know, direct message through social media, general response email address, offgrid@recoilweb.com is our general inbox. So anything you liked, didn't like, would like to see in the future, we'd really appreciate your feedback, because at the end of the day, we're doing this for you guys. So thank you so much for your participation. Panelists, again, I really appreciate you guys coming together on short notice for a topic that obviously is on everybody's minds right now.